Bonjour, اليوم مع دكتورة هانية. She's a dermatologist and hair restoration surgeon. Good morning.
Hello.
How are you, gorgeous?
Thank you. I'm fine. Thank you.
You look so beautiful, as always. Dr. Hanieh, I want to ask you about hair restoration, hair transplant, actually. What is the youngest age for anyone to do hair transplant?
If you ask me, I believe that the right time to undergo the hair transplantation should be around 20, not before. If you're talking about the androgenetic hair loss, especially in men, because it is still going on, so it is honestly haram to start it early because the patient will still lose a lot of hair. So I do at Clinique Joelle starting from 20.
Okay. I see sometimes clients of Maison de Joelle who are younger than 20 and who are females. There are women who are losing a lot of hair. What can be done about that? And do you follow the same age that you wouldn't want to do any restoration before the age of 20 in women also?
Indeed, in female, the hair loss process has completely another pathology. It is not like men who are starting at the age of 17, 18 and losing because of androgenetic, because of the hormones, which are very aggressive to the hair follicle in special area. The men, they have very special area hair loss.
It's true.
In females, especially if they are very young, 18, 17, even at Clinica, we see patients sitting and crying. They are 17 and they have already maybe lost more than 50% of the hair. So we have to go for evaluation. We have to check what is the reason. The hair loss has always a cause. You can't say that it's just because of genetic at the age of 17. So we have to go through to a lot of investigation to see what is the reason, if it is maybe hormonal, maybe it is deficiency of some vitamins or minerals, and then according to all these reports, we give individually treatment for the patient. We can do hair treatments with transplantation for female, but just if the donor area, if the area where we are harvesting the hair, that means on the back, are healthy. If the female at the age of 17 is losing hair on the back, still is not a good candidate for the hair transplant.
What happens in such a case? I remember I had a client whose daughter was 17 or 18 and she was losing a lot of hair, and the girl wants to get married, and she was too embarrassed to take the veil and for her future husband to see that she had really gaps in her hair. What is a solution? Do you have a solution for girls like that?
First of all, as soon as a patient or a mother is noticing hair loss or thinning hair or seeing a lot of hair in the bathroom what is more than normal, they have to start to visit a good dermatologist with very experienced of hair treatment. So the problem is people are noticing, but they are neglecting it. They are coming too late. Okay. That is the number one. The number two, you're talking about a patient, a special case. She is shortly before the marriage. So in that case, honestly, we can just go for maybe a temporary treatment, which will not be for a long time, and just for this case maybe a little bit extension, a little bit, just to give a little bit more happiness to the patient.
But there's no treatment for such cases?
The treatment is first of all to stop the hair loss. So if you want to stop that kind of hair loss, the treatment will probably take about 4 to 6 months. So after 6 months, the new hair will come slowly, and the new hair will get a little bit thicker. So to get the maximal final results with our treatment at Clinique Joelle, probably you will need still 1 more year. We have just to check that these patients with a lot of other issues must be as well
addressed.
Must go to gynecologists. Most of ladies, young ladies you're addressing, many of them, they have PCOS, they have acne as well. Hair loss, they are coming because they have hair loss, and you see, and the patient has a lot of acne. So because the hormones is disbalanced, and that is why these patients are starting losing hair extremely soon.
So it's good to know that anyone who is suffering from hair loss to literally visit a dermatologist who specializes in hair loss and to try to get solutions early on.
Absolutely.
So it could be diet, it could be a lot of examinations to find out the cause. As you said, there is always a cause, and to see the best solution, but there is always a solution.
Yes, absolutely. There is always a solution. Interestingly, you talk about patients in the Middle East, in our region. A lot of patients, female, they have iron deficiency. The iron deficiency is the number one as a cause for hair loss, behind of the androgenetic. Then we have a lot of patients who are have deficiency with vitamin B, okay, especially with folate. All these things, thyroid issue. There are a lot of patients having thyroid issue.
And that also affects the hair loss. So it's very important also when we're listening to you, for people who are listening to us, not to go out and go and get iron tablets, because if your iron is not low, you will harm yourself more by taking iron supplements. So visit a good dermatologist and listen to Dr. Hanieh very closely. Thank you so much.
You're welcome.
Thank you.